So heart attack is loss of blood supply to the heart, and this causes a shortage of oxygen to the heart muscle, which we call hypoxia. But now, what causes this? Several things cause a shortage of oxygen to the heart muscle, and one of them is what we call coronary artery disease, where there is buildup of the bad cholesterol in the artery that supplies the heart with blood and oxygen. When there is buildup of that bad fats or bad cholesterol, the blood vessel will become small. Therefore, less oxygen or less blood will be supplied to the heart, and therefore the heart muscle, which is responsible for the contractions and relaxations of the muscle, will be receiving little oxygen, and at the end of the day it can just stop working because of the little oxygen. Now, when they are trying to test if you have ever had a heart attack or not, they can come and test something we call like the enzyme which is called lactic dehydrogenase in the body. Now that enzyme can show you whether you have had a recent heart attack or not. But what is the relationship between the heart attack and that enzyme? The relationship is that when you eat, for example, something like glucose, glucose is changed into pyruvate, and pyruvate is changed into something called lactic acid. Most of you know lactic acid as this thing which is produced after you have done exercises, and it's the one which leads to things like muscle, what should I say, fatigue, muscle aches after exercises. That is lactic acid. But now lactic acid also increases irregular heartbeats. These irregular heartbeats can also eventually lead to the shortage of oxygen to the heart muscle, and therefore you'll get a heart attack. Also, if you have things like now diabetes mellitus, because diabetes mellitus is also as a result of increased glucose in the blood. Also, if you have stress leads to the production of adrenaline or cortisol. Those cortisol is a stress hormone, and adrenaline is the hormone which is produced when either you are stressed or you have a fierce or when you experience a fierce situation, or you have been chased by a lion and all that, or you have seen something you don't want to see. That's it. Now these hormones, both cortisol and adrenaline, lead to the production of glucose in the blood. And when glucose is produced, automatically it will be changed into things like pyruvate, and then lactic acid will be produced, and therefore the heart will also, the rhythms of the heart will be irregular, which can also lead to a heart attack. Also, things like poisons will also lead to a heart attack, because poisons like cyanide will inhibit or will stop the production of oxygen in the blood or in the body, and therefore at the end of the day the heart muscle will also not receive enough oxygen, and it will collapse or it will stop, which will lead to a heart attack. Also, things like smoking cigarettes, it might not be so much direct that cigarette will lead to a heart attack, but people think that taking cigarettes will relieve their stress, which is very wrong. Actually, when you take cigarettes, it is going to trigger stress in your body. It is going to lead to the production of things like cortisol and adrenaline, which means that when these hormones are produced, still there will be production of glucose in your body. Remember what I said? When glucose is produced, it will be changed into pyruvate, then it will be changed into lactic acid, and lactic acid causes irregular heartbeats, which are also a cause of heart attacks. Also, things like drugs like metformin, which is an anti-diabetic drug. It is the drug which these people who have diabetes use to lower down their glucose levels. Now, I'm not demoting the drug. It is very important for our life, but I'm giving a fact. One of the side effects of this drug is lactic acidosis. Now, lactic acidosis is the increase in the increase in the amount of lactic acid in the blood or the body. And do you remember what I said about lactic acid? Is that it causes irregular heartbeats. Therefore, when irregular heartbeats occur, there is a high chance that you will get a heart attack. Now, there are so many things you can do. You can change your diet. You can change the lifestyle you are living. For example, you can start doing exercises so that you can lower down the fats in your body and also the glucose in your body. I have made a video about the bad effects of sugar. You can go and check about it and you check it out, how glucose leads to the production of bad fats in the body. Also, you can take vitamin E. Vitamin E also helps in the production or in the rate. It also increases the rate at which oxygen is supplied to the heart muscle specifically. You can also get vitamin E in things like oats. Rice also has vitamin E. You can eat things like, of course, you should be conscious about the amount of rice you eat because it has carbohydrates which are also changed into bad fats and all that. Also, foods like sunflower, it also has vitamin E. Olive oil also has vitamin E. Therefore, even if you are 18 years, even if you are 24 years or 25, you can still take these things to prevent heart attacks. If you are at an age of 40 years plus, there is a high chance that you will get a heart attack. If you have if in your family there is someone who has ever had it, there is a high chance that you also have a heart attack at one point in your life. Also, if you don't do exercises, if you smoke, if you take a lot of sugars, there is a high chance that you get a heart attack. Therefore, be mindful, be mindful of your health, take care of health, eat well so that you can prevent these things that are killing us each day actually. Thank you. Subscribe to my channel.